Everybody, guess what? We are live this afternoon. Before we get started, I just want to say thank you for watching all the coverage of the fallen officer in Brentwood. You can still watch the funeral, which is still taking place on our Facebook page. And we'll have other things throughout the day about that. This afternoon, we're here with Courtney and part of Williamson Medical Group to talk about travel, because we're all going to probably be going somewhere, even for a day trip or an afternoon, maybe next week for 4th of July. So we want to talk with her about travel tips and what to do for your family to keep them safe during this time. How's it going, Courtney?
Good. Yep. Just trying to survive the daily chaos that we've been living in for the past few months, but trying to get back to normal and practice social distancing, of course, wearing face coverings in public, washing our hands, and just trying to survive.
Yes. So we all need to still keep doing those things. Yes. Tell me about, what is your opinion? Should you travel this weekend or next weekend, rather? It's coming up. I'm ahead of myself, but some people I know are leaving this weekend to go out of town, but should people choose to travel right now?
I think it really depends on a couple of factors. If you can still practice social distancing, not only when you're traveling, but where you will be going. As long as you can continue to wash your hands, bring some hand sanitizer, of course, with you if you can find any. And also think about where you are going. If there is a big, hot spot, so to speak, then I would certainly advise not going there. And also thinking about the restrictions that these places may have wherever you get there. If you do have to self-quarantine when you get there. Also who you're traveling with. If they're at a high risk for COVID-19, then probably leaving them at home or not going. And then also if there's any travel restrictions wherever you're living from whenever you return from somewhere. That's something else to think about. But of course, the more that we, are out in public and are traveling, the higher the chances of us contracting COVID-19 are, whether it's on a plane, a train, even at RV camps. You're just going to have more exposure to that and more chances of contracting it.
Yeah. So you mentioned something I thought was interesting. You mentioned airplanes. If people are choosing to travel by airplane, what are some precautions they can take?
Again, I think face coverings, washing your hands frequently, and then the hand sanitizer, covering your cough. That's something we've been hearing from the beginning. I don't know that a lot of the airlines are able to kind of leave that middle seat open. I think some of them had, talked about doing that, but I've also seen reports that that's not happening. So I think just kind of using common sense and, trying to, like I said, cover your cough, face coverings, hand sanitizer, don't touch your face.
Which I'm always doing. I'm like, oh, my nose is itching. Or
yes, I think the more that we try not to, the more that we're prone to do that.
So yeah, we talked about airplane travel. What about those who are traveling by car? Or is there the same apply for that?
Yes, it's certainly, I think, going to be safer traveling by car, but even, public restrooms, stopping at gas stations, stopping to get food, that's just going to increase your chances of exposure. But I think we also have to kind of keep in the back of our mind, we need some sanity. We've been kind of locked up, so to speak, for a couple of months. And so I think as long as we can take those precautions into account, that it's okay to go and travel, but just looking at the areas you're going to, who's going with you, who are you bringing this home to? If you do have, a parent or grandparent that's staying with you that is at a higher risk, then maybe not.
Yeah. So if you're going to visit the grandparents, what about that? Should we wear masks around those who might be at a higher risk, even though you want to see them and you haven't maybe seen them since Christmas?
Yeah, absolutely. That is our highest, risk population. So absolutely wearing your mask and kind of doing the air hugs. So, yeah.
Still doing the elbow air.
Absolutely. Yes.
What about staying in hotels? Are there any special recommendations for that?
A lot of the hotels are taking excellent precautions, doing deep cleanings, also spanning the time between guests checking in and out. So I think hotels you would be fine at. You're going to have your own bathroom there, so that's, you know, a good thing. Just kind of getting there, the stops along the way. But I think hotels would be okay.
Yeah. And then what about traveling? Is there anything like as a family you maybe supplement or some type of vitamin you should take to try to prevent or try to keep yourself healthy?
There's no good medical data to support that. That's kind of been what I think folks have asked for a long time about ways to keep your immune system healthy. I think just getting enough rest at night, following a healthy diet, lots of fresh fruits and vegetables, getting exercise, drinking plenty of water. And like we've always told people, wash your hands, don't touch your face. From the time I became a PA, that's one of the things I've kind of stuck to in terms of trying to stay healthy and avoid even common colds. But in terms of supplements, really no good medical data to support that. Yeah.
Tell me what you're seeing in your practice. You're there in Thompson Station. Tell me what you guys are seeing down there.
We are seeing a lot of our routine patients, routine follow-ups, not a lot of, you know, sick visits, so to speak. So yeah, we're screening a lot of patients that if they do have symptoms of COVID to go get tested. If it's negative, of course, come on in. Let's see if you've got an upper respiratory tract infection or something going on.
Mm-hmm. Well, it seems like, I mean, I know the numbers have gone up. It seems to every day change. So I think we're all still trying to figure out how to do reentry safely.
Yes.
Well, thanks for joining us. Do you have any last tips for us before we go?
Just have a safe 4th of July. Continue, like I said, wash your hands, don't touch your face coverings in public, and hand sanitizer.
Hand sanitizer. Man, I have about a big bottle. I keep refilling all these little bottles with it.
Yes.
Well, thanks again. And hopefully everyone has a great 4th of July. And we will see you guys again tomorrow. Thank you, Courtney.
You're welcome. Thank you. Bye-bye.